Good morning, ladies and gentlemen, my colleagues in Unth, Enugu. It is my pleasure to address you this morning as the Chief Medical Director of the University of Nigeria Teaching Hospital here in ITUKU, OZALLA, Enugu. As you are all aware, these are trying times. The coronavirus pandemic is here with us, and we're beginning to report community transmissions. Currently in Enugu, we have 8 cases, 6 active, 2 discharged, and what it means is that at any point we can have coronavirus in UNTH here. As management, we just wish to reassure you that we are in this together. We are all frontliners, the doctors, the nurses, the pharmacists, the lab scientists, the technicians, the cleaners, the gatemen, everybody that's working in UNTH is actually in some way or the other a frontliner. So we are in this all together, and management is not spared. We just wish to use this opportunity to reassure all of us that we are doing a few things to ensure our safety as workers in UNTH, and to also ensure that when our patients come here, they get the best from us while we are staying safe. Part of the measures that we've taken is that immediately this coronavirus broke out, we made efforts to procure a lot of personal protective equipment to ensure that our staff, when they are seeing these patients, are protected. There are a lot of gloves, a lot of face masks that we've procured, and we have a team that is seeing to daily distribution of these items. We have also ensured adequate spacing of patients that come to the hospital. In this wise, we relocated all the clinics to the general outpatient department, where we set up a big canopy. In that big canopy, patients can ensure physical distancing while they are triaged. We triage the patients, and those that really need extra protection, then we put them in a particular place for special care. Those that are triaging the patients, we ensure that they are well kitted, adequately protected. Those that also have to take away the personal protective equipment that have been removed, we also ensure that they wear adequate protection while doing this. This is one of the things we've done. Also, we have immediately set up a waiting area in front of the casualty, at an emergency department. We started built it from the scratch. The whole idea of the waiting area is to ensure that when a patient comes to the A&E, if there's any suspicion, we will see where to keep such a patient before the infectious disease team can come and review adequately and take adequate management. Beside the waiting area, we also put up a medical emergency unit. The medical emergency unit is also to ensure adequate spacing of patients that come to present an emergency. This is a 16-bed facility which we built from the scratch within this period. We are also going to collapse one of our wards, the oncology ward. We're going to use it as an isolation facility so that when we have a patient that we need to take care of, they can be taken care of in that place. Also, we are providing enough water for every staff so that staff will have water to wash their hands. We have the biomedical engineering department has built a hands-free washing system that ensures that we don't touch any knob as we're washing our hands. We have a sample before my office, and we're also going to distribute so many, about 16 of them, around the hospital at different sites to ensure that people wash their hands without further contaminating them. The tally that we use at the gate, they are adequately sterilized every day for people's use, and immediately they are collected, they are also re-sterilized. The gatemen that are collecting them also are properly covered. We also, as part of the measures, set up a high-powered task force that is headed by the Chairman Medical Advisory Committee, in which all the deputy CMACs are also members. The head of nursing are members of this task force. They ensure day-to-day running of the hospital, ensuring safety of our staff and adequate attendance to the patients. I also want to inform us that we are in communication with the State Epidemiology Unit, in fact with the Honorable Commissioner of Health and all that are involved in the COVID fight in the state. So we have a very good collaboration with the state, and each time we've called them to come and review any patient, they have come. The community medicine department of the hospital is also working very hard to ensure adequate public enlightenment, and we thank them for this. We're also in communication with the Ministry of Health. I talk with the Director of Hospital Services every day to ensure that we're in tune with whatever is happening at the national level. And the NCDC too, we're working closely with them to ensure that all that we're doing here is within the prescription. We are trying to also get a testing center for UNTH. If we have a testing center, we'll be better equipped, we'll better test our people, know those that are exposed early, and commence early management, as the case may be. So as part of the effort to ensure our preparedness for this COVID-19, we have been doing training of our staff, starting with the staff at the A&E, who are the people that are most in the front line. The infectious disease unit of the hospital has been doing this training conscientiously. They've trained so many doctors and nurses and health workers in this hospital. Further expansion of this training will involve our team who have been trained by the CDC on infection prevention control to step down what they have learned to every department of this hospital on infection prevention and control, which is very important. The idea is that each hospital will own its own IPC. So we are already about to do this to key into the global vision of infection prevention and control.
So in that tune, UNTH will be conducting step-down training for their healthcare workers in batches to ensure that every healthcare worker in this hospital is in tune with the hand hygiene as well as the waste management protocols and antibody-resistant management protocols needed to ensure the safety of all healthcare workers in the hospital. As part of the strategy embarked by the hospital to combat the COVID-19 infection is the upgrading of the tuberculosis laboratory to a biosafety-free lab. This will ensure that we can be able to test for COVID-19 in the hospital using the GeneXpert protocol. Likewise, our PCR testing facility has also been upgraded to ensure that we can also conduct PCR testing of COVID-19 within the hospital. All these are strategies set in place by the hospital to ensure that we are COVID-19 compliant, whether in infection prevention and disease control, or in diagnostics, and also in management of COVID-19 infection within the hospital.
Part of what we have also done in preparedness for this COVID-19 is that we have encouraged a number of our departments to become more productive. I already told you about the biomedical engineering. The pharmacy department also has been producing all the hand sanitizers that we are using. And even beyond this hospital, we're already supplying some other places with our hand sanitizers. They're producing soaps and spirits that we're using to clean surfaces. The nursing services department is already producing face masks. The community medicine department produced a number of hand sanitizers and liquid soaps, which they have donated to the hospital for our use. These we have distributed accordingly. Again, a consultant in this hospital, a consultant in ophthalmology department, she wishes to remain anonymous, has also on her own developed face shields for us, about 1,000 pieces she's made for us, and we have distributed these accordingly. And she wants to make as many as we need. So these are all the efforts that people are making, and these are very, very laudable efforts. We encourage them. Finally, I just wish to once more reassure you all that we know that COVID is here with us, but we shouldn't panic. We should be careful. We should ensure that we observe all the prescriptions that have been given, all the rules and regulations we should keep. We should maintain adequate physical distancing. We should wash our hands regularly. We should wear our face mask when we are outside. We should also follow all the health educations that is going on in the public, in the media, and every part of this country. There are leaflets that we've shared out in the hospital. We should endeavor to go through them to see the symptoms, so that once we observe any of these symptoms amongst ourselves, we know where to present. We have set up a very good protocol for management of patients. If anybody has any problem, the number to call is also there on the protocol. I want to assure you that this virus shall not overrun us. We shall overcome. Nobody should be afraid. We should just do the things we're supposed to do well. At the end of the day, we shall all live to tell this story. I want to thank you for the effort you're putting to make UNTH great. Thank you so much as you partner with us to grow our system. Thank you.